Hey guys, it's Dr. Greg with Judice Sports and Rehab. Thanks for joining us today. Today we're going to discuss some success stories, some folks that I've treated with elbow discomfort, elbow pain, elbow dysfunction, and what we did and how they progressed to reaching their goals. We'll also announce what next month is going to be all about, so be sure to tune in for that. Looking forward to it. So let's start off with, this is a bit of a throwback. So this first person is someone that I treated before I had my own practice. So this is someone that I co-treated with a hand therapist. She had fractured her radius and ulna and had been casted for about 4 weeks. Then she was braced for another 4 weeks while she began working with the hand therapist. She had a significantly limited range of motion, only about 40 to 50% of her normal range. She's not going to work, not able to take care of her kids like she's supposed to, like she wants to, and just really limited overall. So while she's working with the hand therapist, she's gaining that range of motion in her hand, she's gaining that strength in her hand, so she's making great progress, but her biggest limitation is not being able to bend her arm far enough to feed herself. So she can only bend it maybe about halfway and not able to finish that motion of flexion to get the food to her mouth. I only saw her one time, which is why it's such a big success story and a fun one to talk about. But we did some manual mobilizations to her elbow, really working on the mobility through the joints there. So it's not just stretching. There's what's called accessory motion, which is how the joints move against each other. And so we spent about 10 minutes working on her accessory motion, followed it up with some stretching and some simple strengthening exercises, and that was the only time I ever had to see her. So she was able to gain that motion back fairly quickly. So again, post-fracture care, very important to have a manual therapist work on you to make sure that you can get that full range of motion to use your muscles like they're supposed to be used. All right, the second one here, let's talk about a current patient who's dealing with some tennis elbow issues. She's a runner, but this summer started to go to the gym more frequently. So she's switched from running once or twice a week to now going to the gym 3 or 4 times a week. And basically what this has resulted in is significant elbow and wrist pain with over gripping. So basically she went from not ever lifting much at all, maybe once a week before, and now she is over gripping with all of the exercises that they do there. Hey Lisa, good to see you. So she's over gripping, whether it's the TRX bands for doing body weight resistance stuff, kettlebells, dumbbells, carrying weighted plates. She's doing all sorts of grip exercises, and she's never done anything that heavy or that strenuous before. So it's a lot of overuse, and most of what tennis elbow is an overuse type of injury. Think of tennis or golf. You hear of tennis and golf elbow. Those are overuse type of injuries. It's the same motion over and over again, whether it's a tennis swing or a golf swing. It just depends on what side of the elbow is most affected. This is not someone who had significant weakness coming into care. She was able to function and never had any elbow pains until she started going to the gym and overtraining. So she wants to be able to go to the gym. She likes how it makes her feel overall, and that's a great goal to have. And I'm not saying don't go to the gym by any means. I encourage you to be as active and as mobile as possible. But for her, she needed a bit more strength to keep that function pain-free. And so, yes, of course, we need to work on her strength. Yes, of course, we need to work on her range of motion. But most of what we did with her was education. So a lot of education on adjusting her technique with gripping, making sure she's in a neutral position. Because neutral at the wrist is not a flat line here. Neutral at the wrist is actually slight extension, which is if you just relax your hand and grip, that's neutral. Okay? So taught her how to use her hands and her wrists appropriately for gripping. And then we also talked about not over gripping. So she was max contraction all the time just because that's what she felt like she needed to do because they were new exercises. The goal is to grip just enough to maintain your stability, not over grip to where you're white knuckling it all the time. When you're getting back into the gym after a long time of not being an active person, the best thing to do is increase your weight or increase your time in the gym by the safe way is about 10% per week. So if and we'll just use running as an example just because we can use time. So if you went to run and you ran for 10 minutes on Monday and it just wiped you out, okay, well, when you come back next Monday, it's probably not a good idea to try 15 minutes. If 10 minutes was pushing it and maybe a little bit too much for you, only progress by about 10 minutes or 10% a week. So looking at maybe only 11 or 12 minutes that first time. So that slow 10% per week progress is really important to build slowly and build safely. If we try to set a new record or go too far too fast, that's when you're more at risk for injury. But again, it's pay attention to your body. If you're not responding well to it, then slow down. If you are progressing quicker than that and no issues, keep doing your thing. And then last one, this pertains to most baseball players that I've seen. I've worked at several places and still treat some athletes these days. For most baseball players with elbow pain, the non-surgical, we'll go non-surgical with this. Most of them are having pain with throwing, of course. That's their sport. They're big-time throwers. Typically, it's not an elbow weakness. Typically, it's not an elbow range of motion issue. Because of the mechanics of pitching being so specific, right? There's so many moving parts. It's really more of a let's spread out the forces over every joint as equally as possible so that we're not overloading one joint and underutilizing another joint. So for example, in a baseball player, when they're pitching, typically what I see is elbow pain first, but more than likely that comes from shoulder weakness and shoulder blade weakness. Okay? Shoulder blade and shoulder, they are what take most of the force, and that's what should take most of the force because they're bigger and stronger joints typically than the elbow. And as we discussed last week, we talked about there being every other joint being, hey, Shari, good to see you. I've lost your question, but I'm going to try to remember it and answer it right after this last success story. So the whole purpose here is every other joint is mobile, every other joint is stable. The elbow is a mobile joint, is a stable joint. So we need to make sure that we have as good as mobility and stability above and below the elbow to decrease the stress at the elbow. So just because you have elbow pain doesn't necessarily mean that that's where the original problem is. And that's what I pride myself in as a therapist, is not just treating the symptom, but treating the source. So I think that pretty much wraps it up for the success stories. Sorry, do you remember your question? If you can just type it in real quick, I can see it on the screen if you type it in. I think you asked about tennis elbow, what to do. Give her another couple of seconds. Just kind of discuss exactly. Okay, so it is tennis elbow. All right, so tennis elbow, right? It is the lay person's name for lateral epicondylitis, okay, which is a long way to say pain on the lateral side of the elbow. Okay, so basically with tennis elbow, as we discussed earlier with some of the over gripping stuff, typically it's an overuse type of injury. And so the big thing is we want to avoid over gripping, overuse as much as possible. Sometimes that's changing the mechanics of the motion. And if your injury is actually with playing tennis, I would definitely want to look at your swing mechanics and look at how you use your shoulder, how you use your shoulder blade, how you use your wrist, and how that affects the stress at that lateral elbow. If it's more with like workouts and body weight resisted stuff, which I think is what your question was about, then again, we still want to work on the mechanics of those motions that seem to aggravate the elbow the most. So the generic is decrease the stress to that area, and sometimes it's strengthen above and below that joint. Sometimes it's okay. Sometimes it's just change the mechanics. And so yes, strength is important, but that's not what I typically see as the biggest issue. Of course, we will work on strength if you become a patient and we're working towards a specific activity and we determine that, yes, you do have weakness. But that's not the biggest thing that I see. Most people don't have pain with day-to-day life. It's just with the same motion that is overused. So I hope that answers your question. If not, definitely send me a direct message and we can chat about you, okay? So that kind of wraps up the elbow. I hope you guys enjoyed it. But next month, I'm really looking forward to it because it is shoulder month, okay? I love the shoulder, okay? That is my favorite joint to work on. That is my story as a previous shoulder injury myself. That's what I enjoy working with the most. So I'm looking forward to it. We'll do some more Q&A for August for the shoulder. Also want to do, kind of like we did this month, do one topic that I see very frequently, and then some success stories maybe towards the end of the month. But I think we get 5 Fridays in August, so we may have to have something fun on that 5th Friday, but we'll figure it out. So anyway, thank you guys for tuning in. I hope you enjoyed the video, and we'll see you next Friday.